A vaccine co-developed by Moderna and the National Institutes of Health is formally under consideration for authorization by the Food and Drug Administration, just a few days after Pfizer and BioNTech submitted an application for emergency use of its vaccine. The Trump administration has repeatedly promised any vaccine will be distributed within 24 hours of a green light from the FDA. But that talking point may oversimplify the steps required between now and the first shots in arms. Here's what to expect over the next few weeks. First comes the FDA's scientific review. The FDA will also share the data with a group of independent scientists called the Vaccines and Related Biological Products Advisory Committee, or VRBPAC. The committee will vote on whether to recommend authorizing the vaccine or not authorizing the vaccine. The recommendations are non-binding, but very influential. FDA typically follows the recommendations of the VRBPAC. Additionally, the advisors will meet on a virtual call that anybody can live stream, and anybody can submit a public comment. Experts hope this transparency will build trust in the high-stakes process. Here's where things get murky, though. FDA officials like Commissioner Stephen Hahn and Center for Biologics Evaluation and Research Director Peter Marks have said in press interviews and public appearances that any authorization of a vaccine could take days or even weeks after this meeting concludes.
It will be a matter of weeks. It could be from days to weeks.
But Operation Warp Speed co-lead Moncef Slaoui has said that he expects authorization to quickly follow the VRBPAC vote and could even happen the same day.
Our plan is to be able to ship vaccines to the immunization sites within 24 hours from the approval. So I would expect maybe on day 2 after approval.
Next, the CDC's Advisory Committee on Immunization Practices will meet on whether to recommend the vaccine. ACIP has been working on recommendations for which populations should receive the first doses for months now. Still, the ACIP will need to recommend each vaccine individually. This ensures the private insurance companies will cover the vaccine without a copay. Under the CARES Act, insurance companies have to cover any COVID-19 vaccine recommended by the ACIP within 15 days. Next, states will begin to receive the first supplies of vaccines. Questions about priority have been influenced by the ACIP and a separate group convened by the National Academy of Medicine, but states have been largely left to their own devices on how to manage distribution. So we could see big differences from state to state, even zip code to zip code, on who has access to a vaccine and who doesn't.